Hi, everyone. I am here with Dr. Powell. My name is Dr. Alleda Mack. I have the privilege of being one of the hematology oncology fellows at Karmanos Cancer Institute. And today we are going to talk to you about a couple things related to cancer. Do you want to say hello, Dr. Powell?
Yes, I'm Dr. Isaac Powell. I'm a urologic oncologist. I've been at Karmanos Cancer Institute for over 30 years, seeing patients, teaching residents, and doing research in cancer.
Wonderful. Okay, so today, so you can kind of follow along with your thinking, we're going to talk about a few cancer myths. We're going to discuss medical mistrust, and specifically some of the medical mistrust in the African American community. We're going to discuss the importance of early detection, and then screening and prevention, and finally, a little bit about cancer in the African American community. So let's go ahead and jump right in. So we picked up a couple of cancer myths that we want to talk about. The first is the idea that having cancer is a death sentence. What are your thoughts, Dr. Powell?
Absolutely not. And we need to understand that you can die from cancer, but you can also live a good life, if you're diagnosed early. Early meaning going in and being screened and participating in treatment, aggressive treatment if necessary. You can live a life full of happiness without cancer after it's treated.
And Dr. Powell, I heard through you that, and I would love it if you would share with us your personal story of having cancer.
Sure, absolutely. I have no problems with that. I've had two cancers. I had prostate cancer 22 years ago. I had bladder cancer 12 years ago. Both were diagnosed early, and obviously I've been cured. I'm still here, still working, and enjoying my grandkids, my kids, and my friends. And so you can do that too, but it certainly requires early detection. And even if you don't have symptoms, you should go and be screened and tested, because in prostate cancer, many men do not have symptoms and can have spread all over the body and not have any symptoms. So that's extremely important to be tested, even if you don't have any symptoms. Women are more likely to go in and be tested. Men are not.
Yeah, for sure. And we're gonna keep talking about the importance. We'll be like broken records by the end, but we can't overstate how important it is to get tested early. And so one more thing with cancer being a death sentence. So I care for a lot of patients also, and as a fellow, I currently get to work with Dr. Powell a lot, doing like prostate cancer, bladder cancer, but I work in the other disciplines also, and we see across the board that getting cancer, detecting it early, treating it early, it's not a death sentence. It's certainly scary. We don't want for you to have cancer. We don't want for your family members to have cancer. No one wants to hear anything about cancer. We were talking a little bit, Dr. Powell, about how people, maybe we can touch on that, how people respond when they have cancer. What are
Yes.
the things?
Well, yeah, and that's very important because, but again, as I say, men are a problem because they take better care of their cars than they do their bodies, and therefore don't want to hear anything about cancer or treating them, because another thing is that they feel like they're less masculine if they have any kind of disease. And so you have to tell them that manhood is not based on a disease. There are many other things that make you a man other than that, even including sexual function, because that's a very important problem. And prostate cancer, yes, you may have some impact on your sexual function, but that can be treated. And you can be even better than you were perhaps before if you're treated. So, yeah, and as I said, I had cancer. I had chemotherapy for bladder cancer. I had major surgery for prostate cancer, but I've survived all of that. And I'm very happy that I had it. Again, early detection.
We're happy you had it too, Dr. Powell. I don't know what we'd do without you. One of the things that I see and experience with patients is that sometimes when people hear cancer, it's really hard. It's such a scary time. It's hard to hear anything after that. And so I think it's also important to talk about just the emotional side of it, because it all goes together, and people a lot of times they go into denial, or they have incredible anxiety about that. And so I guess the things I would recommend is that you talk about it, keep showing up to your appointments, bring family members, well, post COVID, bring members with you, but at least find out what your options are. You are always steering the boat, driving the ship when it comes to your health and the choices you make, but at least gather information so that you can make like a fully informed decision, and don't let the denial, the anxiety, the fear kind of run you off. What are your thoughts, Dr. Powell?
Yeah, I think so. In fact, talking about it is very helpful. In fact, we've had a support group of men who've had prostate cancer to talk to these men, survivors, and that's very important. If they talk to somebody who's had it, they feel much more at ease. And that's one of the advantages that I have, is that I've had the cancer. I can tell them what they're going to go through. I can tell them what to expect after. The quality of life after is outstanding, because you know it's behind you. And you can look at it as something that you experience and you beyond that. So talking about it is extremely important.
Yeah. Across the board, regardless of what kind of cancer it is.
Exactly.
So the second cancer myth is that sugar either makes you have cancer or it makes the cancer worse. And so some of the data, as you're discussing, is a mixed picture, but I think there are a few things that we can say about it. I'll let you go ahead and go first, Dr. Powell, and then I'll jump in.
Well, it's so controversial about nutritional factors, and we don't know enough about them to say whether it's good or bad. And so we continue to have controversy about those. My concern is a high-fat diet, particularly a high-fat diet, drives many cancers. And so we recommend a high-fiber diet and a low-fat diet. And there are some nutritional factors, nutritional components that we know may prevent cancer, particularly prostate cancer, is tomato products. And now there are other nutritional factors like broccoli and other juices that may be important in terms of preventing or controlling cancer. So, but we don't know as much as we need to know about nutritional factors. And the sugar has been controversial, and you may want to say more about sugar in that diet, but I think that it's out that we don't know enough yet.
I agree. I will say one thing that we can add from working with a lot of our amazing nutritionists at Karmanos is that, when people have cancer, their families, they want to do everything they can to fight it. And some of the things are, people say, well, I'm not going to, no more sugar, no sugar at all. I'm just going to have broccoli. I'm going to have broccoli and water, spinach and water, and it's all going to be in a smoothie. And one of the important things is that not to avoid sugar and at the expense of having a balanced diet. So please eat, if you have cancer, if your family member has cancer, it's okay for them to eat a balanced diet, because you don't want to become so nutritionally deplete because you're only eating, some very, very restrictive diet that the person doesn't have enough energy to kind of be robust and up and functioning. So I think that part is less controversial than, if you're eating a bunch of candy or cookies.
And something that may be even more important than in your diet is exercise.
Yes.
That is extremely important. And the research that I've done shows that the genes and biological factors that cause cancer to progress, exercise will decrease the expression of those genes. They did a study in breast cancer that showed that exercise decreased the genes that cause breast cancer to progress. So exercise is the key to good health, not just cancer, but heart disease, any disease. Exercise. I mean, exercise to the point where you're sweating. That's what I tell my men. If you just casually walk, that's not good exercise. You got to really put forth some effort.
That goes for the ladies too.
Ladies too. All right.
Come on, we all can get out there and break a sweat. And really, where the fat is matters, right, Dr. Powell? Like that.
Yes.
That,
oh, yes.
Yeah, that central obesity where we look like we're, in some trimester of pregnancy, that's hard on our organs. It's hard for cancer. Yes. It's hard for diseases outside of cancer.
Yes. If any of my men are listening to this, they know that I am the belly terrorist. If they come in with bellies, I tell them that's the worst thing. That's lethal. It is absolutely lethal. Not only in cancer, but heart disease, anything, diabetes, you name it. The belly fat is horrible. Stop it.
Stop it. Okay. And, this pandemic has been hard on us in so many ways. And I think one of the things that's been difficult is that, we've been sitting around more, myself included, and we gotta get moving. We gotta do what we can to take care of ourselves.
Absolutely right.
Lest the belly terrorists get us over here with Dr. Powell. Okay, and then the final myth we want to talk about is that the idea that if your family member has cancer, be it like a cousin, an aunt, an uncle, your parent, your sibling, that you are destined to get cancer.
Yeah, I did a study in prostate cancer, hereditary prostate cancer, about 20 years ago, and it's not, and in fact, breast cancer, prostate cancer, people who have hereditary cancer, that's a small percentage of the total population who have cancer, like 5 to 10% in breast cancer, and maybe 10 to 15% in prostate cancer who have hereditary cancer. And how we define hereditary cancer is if 3 or more members of the family have a particular cancer, in the case of prostate or breast cancer, and under the age of 50, then they're high risk for hereditary prostate cancer. And what that is passing a gene from one generation to the next. Whereas you may have a member of your family, just one. That doesn't mean you have hereditary prostate cancer, and doesn't mean that you got the cancer from your father. It means that maybe you're eating the wrong diet. That's one factor. Maybe you're working in a place where there's pollution that's causing you to have that cancer. That's a possibility. But again, the hereditary prostate cancer is a small percentage, and no, you can't necessarily absolutely pass it. In fact, most people who have cancer do not have family members who have cancer.
That's it. That's it. And to kind of tap into that, and then to lead us into the next thing, the talking about screening and the guidelines, and then the importance of it for the major cancers, is that if you have a family member who has cancer, please don't let that fear drive you away from getting screened, or to just think that you're automatically going to get it. It's always better to show up to your doctor, to discuss it with them, to get more information. Okay, so let's talk about screening. That's a big thing, because the earlier we catch the cancer, if we have it, the better off we are.
No question.
And that is maybe not always the case in the African American community, which we can talk about also.
But that's extremely important. And I don't know that I said it before, but in prostate cancer and in breast cancer too, you may not have any symptoms at all. And you may have cancer. In fact, most of the men we see don't have symptoms, and they're coming because they've had a PSA. But not only should you have a PSA, a rectal exam, which men don't like, doctors don't like to do them either, but they need to be done. And in lung cancer, if you're a smoker, you need to have what is called a low-dose CT scan. In fact, you should stop smoking.
Stop it. Listen, time out. If you are smoking in the year 2020 going into 2021, please stop. There is no question that smoking is linked to cancer. Please, let's do better. Please stop smoking. Please, it's killing you. Please stop. Okay, go ahead, Dr. Powell. I just wanted to make sure we're known.
And cigarettes cost a lot of money too. I tell my patients, add up the amount of money you spend in a year on cigarettes. $1,000.
$5,000 a pack a day. $5,000.
That's a lot of money.
You could donate that to a kid's college fund, or do something else. $5,000. You're basically burning it. Just set it on fire. So stop it. Stop it. And with the prostate cancer, dare I say, no man wants a rectal exam. No woman wants a rectal exam anyway, either. But what's worse than getting a rectal exam, Dr. Powell? Prostate cancer. Getting prostate cancer, I would say.
And dying from it. Men still die from prostate cancer. It's a horrible death. It's very painful. You may bleed. All kinds of horrible things can happen.
Yeah. So let's try to get ourselves screened early. Okay, so we talked about prostate cancer. I would say for women who are the age, so all of these guidelines, all of these recommendations are different. If you have a family member, especially what we call a first degree family member, so if it's like your mama, your daddy, your sibling, talk to your doctor, because the recommendations for screening for you may be different. But if you're a woman who is 40 and up, please begin having annual mammograms. Because like Dr. Powell said, you may not feel anything. You could have a cancer and not know it. And the better you do is often linked to how early we detect it, like the stage that you are. If you're smoking, we all agreed that we're going to stop smoking. And then for men and women who are 45 and older, please talk to your doctor about getting screened for colorectal cancer. It's a colonoscopy. No one doesn't really want a colonoscopy, but it beats the idea of having colon cancer. Okay.
One other thing we didn't talk about is that the myth of cancer spreading if it hits the air. I used to hear that a lot. Don't hear it as much now, but there is no basis for that happening. And it started probably years ago when men and women had advanced cancers. They would open them up and couldn't do anything about it. They would close them. They weren't dying from the air. They were dying because the cancers were very advanced. Mm-hmm. And that was causing the fatality of the disease at that time. So air does not cause it to spread.
Yeah, agreed. Okay, so we have talked, we're doing good work over here, Dr. Powell. We're covering good ground. So we talked about some
Yes.
cancer myths. We talked about early detection. And then I think the other thing that I always tell my patients, in any branch of medicine is that I think finding a doctor and finding a physician is kind of like dating, right? Like not everybody is going to be a good fit for you. And everybody deserves good care. That's what we do at Karmanos. That's what we do, I think, in places across the nation. I'm very proud of the work that we do in our cancer center. But keep looking. If you don't find someone where you feel comfortable, where you feel you can partner and share and be heard and be honest, you have to keep looking to find a good fit. I think that is kind of part of the foundation for, especially if you have cancer, of helping manage it. What do you think, Dr. Powell?
Oh, absolutely.
Absolutely.
One of the things that I continue to stay here and work is because I know that people want to see people. They want to see doctors that look like them. They feel more comfortable,
Yeah.
and they feel that they can trust what I say. And that's extremely important. We need more African Americans and the African American physicians to see the population in the African American community. That's extremely important. One thing I want to say is that this disease, particularly in prostate cancer, people think it's just in this country, but men of West African descent in the Caribbean and South America have a high incidence of prostate cancer as well. And in fact, in Ghana and West Africa, the disease is even greater, the incidence is even greater than here in this country. Suggesting a genetic component contributing to this is what I'm talking about. The slave trade is contributed to the geographic distribution of what we see today.
Absolutely. So the things that we've discussed today, as far as like screening and prevention, if you have any questions, we have a ton. I know we went over it quickly. There's a ton of information on our website at karmanos.org, and you can also call us. We want to talk to you. We want to hear from you. We want to help you. It's a privilege to serve our community. Just call 1-800-Karmanos, and we have brochures on screening. If your family members, you think that would benefit you, we have it available to you. And then we've had a lot of good things we said today, Dr. Powell, and it's such a privilege to sit here and talk to you. I just wanted to see if you had anything you wanted to add, just talking very specifically about the cancer in the African American communities. You've been doing this a long time, and we benefit from your wisdom. So if you have anything you want to share with us.
I think we've really covered it quite well. And again, the fear and the distrust, we have to overcome that because that's what accounting for the death rates being higher among African American as well. It's our health-seeking behaviors. We've got to change that. In particular, men, they need to take better care of their bodies than they do their cars. And they need to exercise and get rid of the bellies.
Get rid of the bellies. There it is. Yeah. And if you, I've seen this multiple times. If you have a problem in your body, don't let fear stop you from showing up, because we see patients over and over and over. There are 4 stages of cancer. There are little subgroups in them. Stage 1 is it's the earliest, and stage 4 is the latest. And stage 4 we can manage, but typically stage 4 is not curable. And we see people time and time again that they show up with stage 4 disease after, sometimes you don't feel if it's there, but sometimes you do, and people let fear stop them from coming. So please come. Send yourself, if you know anyone who's having issues, please send them, because inaction is a choice, and it takes other choices and options from you, and that's gut-wrenching for us, for our patients and their families. So just please come. We're here for you.
Very good. Enough said.
Enough said. Well, it's been a privilege, as always, to talk to you, Dr. Powell. Thank you for sharing your insight and yourself with us. We appreciate it.
Okay. Thank you.
Okay. Bye, everyone. Take good care.